Hello everyone, I am Venus Cardinia Sinto and today I'm going to talk about penicillins. So, penicillin was a single substance and the variation in activity of different products was because of the amount of the inert materials in the samples. It is a group of antibacterial drugs that attack a wide range of bacteria. So usually most of the bacteria cater niya. They were the first drugs of this type that the doctors used. And in terms of the discovery and manufacture of penicillin, it has changed the face of medicine as these drugs have saved millions of lives. And penicillin fungi are the source of penicillin which people can take orally or via injection. So this is the general structure of penicillins. It is composed of thiazolidine ring, beta-lactam ring, and acyl side chains. For the mechanism of action of the penicillin, uh, when the penicillin is administered orally or via injection, it will bind and inactivate the penicillin binding proteins on the cell wall of susceptible bacteria. After that, it will inhibit the transpeptidase and prevent the peptidoglycan synthesis. And when the peptidoglycan synthesis is prevented, the cell wall deficient is formed. Usually dito ang nag-form is the spheroplast and filamentous forms. And there will be the breakdown of all parts of the cell or tissue by self-produced enzymes or what we call the autolysis that will result to the bactericidal effect or cell death. So, yun yung mechanism of action ng penicillin. For the mechanism of action, pharmacokinetics, clinical use, and adverse effect, under the mechanism of action, so penicillin prevents the synthesis of peptidoglycan, which is a vital part of the cell wall. Also, they do not interfere with the synthesis of other intracellular components, as well as do not affect human cells because we have no cell walls unlike the bacteria. For the pharmacokinetics, ang PEN-G and ang PEN-V, they are the natural penicillins. And usually, PEN-V is given orally because it is acid stable and PEN-G is given parenterally and it is acid labile. In terms of the absorption of the penicillin, it is complete and rapid and its peak plasma level is attained in 30 minutes as well as there is 60% reversible plasma protein binding. For the clinical use, so it is widely used in otitis media, meningitis, sore throat, pneumonia and respiratory infections, septicemia, gonorrhea, urinary tract infections, endocarditis, infections with Pseudomonas, and these are the bacteria na kinakater niya, Streptococci, Meningococcus, gram-positive bacilli, spirochetes, and marami pa. In terms of the adverse effect naman, so ang major adverse effect of penicillin is the GI system or yung gastric natin. So, ang example nito is nausea, vomiting, diarrhea, abdominal pain, glossitis, stomatitis, gastritis, sore mouth, and fiery tongue. And the reason for some of this effect is associated with the loss of bacterial flora. For the hypersensitivity naman, it indicates that there is a mild allergic reactions such as rashes, pruritus, and fever. Wheezing and diarrhea may also occur, and there is an anaphylaxis that can also happen that will lead to shock or death. It also occurs in 5 to 10% of those receiving penicillins. For the precautions, so bago ibigay ang penicillin, history of previous administration and allergic history should be noted. In patients with history of asthma such as allergic rhinitis, hay fever, Penicillin should be avoided in such cases because there is an increase of penicillin allergy, and it should be used cautiously in patients with hearing loss or renal insufficiency, or pwede rin na they should receive just low doses of penicillin lang. Also, it should not be mixed with any other drugs in the same syringe because magkaroon ng drug interactions. And it should be not used, aminoglycoside should not be used in drugs during pregnancy because there is a risk of fetal ototoxicity. For the contraindications, penicillin inactivates aminoglycosides. Yes, under some mechanism of action. Also, concurrent use of other ototoxic meds such as loop diuretics will increase the risk of hearing loss. And patients should avoid penicillins or cephalosporins with hypersensitivity. And it should be used cautiously in patients with renal disease and during pregnancy and lactation. Kasi nga magkaroon ng risk of ototoxicity. And also, it should may interfere with birth control effectiveness, as well as the effectiveness may decrease if it is used with tetracyclines because of drug interactions. So these are the drug interactions with tetracycline, chloramphenicol, erythromycin, which are the antagonists, with penicillin with aminoglycoside, of course, penicillin and hydrocortisone in same syringe because it will inactivate each other pharmaceutically. Ampicillin with allopurinol, which causes high incidence of non-urticarial maculopapular rashes. And lastly, penicillin with probenecid, which prolongs the action of penicillin by decreasing tubular secretion. That's all. Thank you for listening.